Hello, everyone. May is Mental Health Awareness Month. Every week this month, we will be spreading awareness of the amazing mental health services that are provided by AbbeHealth. Today, we are going to be focusing on our Abbe Mental Health Clinic services, reviewing the various services that are available to individuals through our community mental health centers. These clinic services include psychiatric assessments and medication management conducted by psychiatrists, advanced registered nurse practitioners, and physician's assistants. Therapy services such as assessments and counseling. These include individual and group services provided by licensed independent social workers, licensed mental health counselors, and licensed marriage and family therapists, as well as those on a temporary license. Group services are facilitated by a therapist and vary depending on availability and community need. Some groups offered include STEPS, Stairways, DBT, and anxiety and depression groups. Some of these groups target specific age ranges, such as adolescents. Medical support services act as a bridge between the psychiatric provider and the client between visits, providing long-acting injections, prior authorizations, vitals, and health questionnaires. Therapy and psychiatric services are provided to both adults and children and can be provided via telehealth or face-to-face in the office. Substance use disorder services include assessments and counseling by certified alcohol and drug counselors. Peer support, as well as recovery coaches, offer support based on lived experience and training. Focus on developing natural supports and community inclusion as part of the recovery process. Medication-assisted treatment, or MAT, is provided by psychiatry staff most often to support recovery from alcohol and opioids. SUD services are based at our Cedar Rapids location, but like therapy and psychiatry, can also be offered via telehealth for clients that need it. Our Cedar Rapids location also offers services such as FIRST, or the First Episode Recovery Support Team, which is comprised of an interdisciplinary treatment team consisting of a team leader, psychiatry, individual therapy, family therapy, employment and education specialists, and a community support specialist. First is designed for individuals aged 15 to 40 who have less than 1 year with psychosis symptoms, such as delusions, hallucinations, or confused and disturbed thoughts. First is covered by private pay insurances and is also grant funded. Outreach and engagement services are available in the Lynn County area. These services assist individuals that are transitioning out of the hospital. The goal of these services is to help individuals get connected with outpatient services and to prevent the need for future hospitalizations. Focusing on clients seeking outpatient services through AbbeHealth and are not already receiving community-based or IHH services. Clients in this program are aged between 14 and 64. The outreach and engagement team consists of care coordinators and peer support specialists. These services are funded by the Certified Community Behavioral Health Clinic, or CCBHC, grant. For the current grant cycle, the target population is individuals discharging from Unity Point Health psychiatric units and receiving services at Abbe Mental Health Centers in Cedar Rapids or in Hiawatha. And finally, we have a new program that is starting this month. Assisted Outpatient Treatment, or AOT, will only be available in Iowa City. These services will function to assist individuals who have involuntary civil commitments to continue their treatment effectively. Court dates for participants are held in the Johnson County HHS office to lower the stress and intimidation participants may feel at the courthouse. The Director of Assisted Outpatient Treatment will function as the liaison between the court, the patient, and the care team. This is the first AOT program in the state of Iowa, and it will be a 2-year pilot program. The goal of AOT is to help participants stay out of the hospital or jail, with a focus on keeping individuals in their communities with increased assistance with medication adherence, follow-up appointments, etc. Participants typically have a diagnosis of schizophrenia, bipolar, or depressive disorders that lead to psychosis. These participants will remain in the court program for 15 to 18 months. Assisted outpatient treatment is funded by the East Central Region, or ECR, and the first participant will be admitted in May of 2023. Thank you all for taking the time out of your day to learn about these amazing services provided by AbbeHealth. Have a wonderful rest of your week.